Hi, this is Dr. Dean Kelaita, Calaveras County Health Officer with a COVID-19 update for July 7th, 2020. COVID-19 disease occurrence continues to expand across the United States, California, and Calaveras County. The U.S. as a whole has seen 3 million cases with 133,000 deaths. California has reported 271,000 cases with 6,500 deaths. Calaveras County is experiencing an alarming increase in COVID-19 cases. Last Thursday, July 2nd, there were 13 additional cases reported in Calaveras County. That's the largest single-day increase since the pandemic started. We've confirmed 20 new cases since the beginning of this month. That's a 40% increase. Most cases center around Valley Springs, but other population centers are affected as well. Public Health reported 61 confirmed COVID-19 cases, with 25 cases so far having recovered. There's been no reported deaths at this time in Calaveras County residents. Our public health staff's continuing to determine the possible causes, contacts, and close contacts to those cases, and trying to do what's called contact investigation and contact tracing. This is a time and labor-intensive process, and our health department staff is continuing to perform this function, but it may be the case that we're not able to keep up if cases continue to expand. Testing for COVID-19 is another critical component in the fight against coronavirus infection. Testing is still readily available at the OptumServe site at the Calaveras County Fairgrounds. It's open Tuesday through Saturday, and beginning today has expanded its hours from 7 a.m. to 7 p.m. Testing is available for those 12 years of age and older. You can make an appointment on the website or by calling the 800 number that's listed on our website. Symptoms of COVID-19 infection occur between 2 and 14 days after infection. These symptoms include fever or chills, cough, shortness of breath or difficulty breathing, fatigue, muscle aches or body pain, headache, loss of taste or smell, sore throat, congestion or runny nose, nausea or vomiting, diarrhea, or other gastrointestinal symptoms can occur as well. Some people with COVID-19 infection may not have any symptoms at all. These asymptomatic individuals are still able to transmit the virus to others. Based on what we're seeing since the 4th of July holiday weekend, it's important for the public to refrain from group activities and large-scale gatherings that have been shown to spread COVID-19 infection. What we're seeing in Calaveras County continues to be a significant outbreak of COVID-19 in several regions of our community. Widespread community transmission is now taking place throughout Calaveras. I want to emphasize the critical importance of people taking precautions and act as if everyone you come into contact with has COVID-19 infection. We need to protect our hospital and our ICU capacity. If this trajectory of disease continues, we're on the cusp of a spiraling epidemic that's going to get completely out of hand. It's going to be important for everyone to do the actions that have been shown to reduce disease transmission. These actions are wearing a cloth face mask when outside. These actions are also simple things, scientifically effective things that people can do to prevent transmission. When you go outside, physically distancing, washing hands, maintaining that physical distance of at least 6 feet between people at all times. Those with higher risk of complications from COVID-19 infection are especially encouraged to stay inside and prevent exposure to others. We've got to protect the most vulnerable members of our community. So the best way to avoid exposure are, again, stay at least 6 feet away from people when outside, washing your hands with soap and water for at least 20 seconds, avoiding touching your nose, eyes, and mouth with unwashed hands, wearing a face covering over your nose and mouth if you're in public and around others. These simple and yet scientifically effective strategies are the things that the public can do to prevent coronavirus transmission and continuing escalating cases in our community. As I said, we're on the cusp at this point of a significant epidemic in our community. If you look around at some of our neighboring jurisdictions like San Joaquin County, Stanislaus County, we're seeing significant increased case activity in those communities. So if you travel to those communities for work or for shopping, please be aware that if you encounter others, assume that they have coronavirus infection and take precautions, wear your face covering when outside, and remember to wash your hands and practice physical distancing. We'll be releasing updates twice a week from the Calaveras County Health Department in the form of press releases, and further information will be released to the community in a timely fashion as soon as we get it, in addition to these regular updates. So thank you for doing your part to keep our community safe, prevent disease transmission, protect the most vulnerable members of our community from hospitalization, ICU care, and even death. Thank you.